Good morning, everyone. My name is Brittany Sandage, and I am here at the headquarters of Prevention Action Alliance, formerly known as Drug-Free Action Alliance here in Columbus, Ohio. Today is our monthly advocacy call. We're thrilled that you were able to join us today. With me is Tony Coder, our Director of Advocacy and Public Policy. And before we sort of get into some of those nitty-gritty, we just wanted to take a quick minute to share with you some of the updates that you'll be seeing coming as they relate to our advocacy activities, our communications, and things you'll be seeing in the forthcoming months. So as many of you know and have received word, we are making the transition from Drug-Free Action Alliance to the Prevention Action Alliance. We're excited about this evolution. It is a chance for us to look at substance abuse prevention and substance misuse prevention holistically and comprehensively as it relates to overall wellness here in Ohio. So as we're making that transition, you're going to see several new things. Our new website is going live this week. You'll also begin to see communications coming from the Prevention Action Alliance domain. We've already, through some of our early testing, identified that with that transition, some folks might be getting caught in the filters, their spam or their clutter filters if you're using Outlook. Be sure to go in and add contact at Prevention Action Alliance and Tony Coder's T-Coder at Prevention Action Alliance into your safe sender list, just to be safe as we're working out the bugs. It's such an exciting transition for us, but we know that we want to make sure everyone gets all of their legislative weekly alerts as well as the invitation to these advocacy webinars. If for any reason you are having difficulty, please shoot us a quick email or give us a quick call. We are troubleshooting, and we've got a great team supporting this transition as we go. But just wanted to get that out there now at the beginning of the broadcast, and hopefully we'll be sending out additional information to help you troubleshoot any additional options. All right, without any further ado, I will kick this over to Tony. Tony, take it away.
Thank you so much, Brittany. So good to be with you on this Tuesday morning. Raining down here in Columbus, Ohio. Storming, actually. So hope it is sunny and nice where you're at this morning. First off, wanted to, most of you, if not all of you already know this, the DFC program and the HIDA programs were saved in the president's budget, which means that we, because of your advocacy, because of the calls you made, the letters you wrote, the signing on to the letter. Some of you signed on to the letter that we created from here at Prevention Action Alliance. We avoided this, quite frankly, catastrophe that would have been tragic for an awful lot of communities, and really probably set communities back, decades from what they're doing. So we are very, very thrilled to be bringing that news and sharing that this is going on. But there are things that we still have to consider, because in the president's budget, we also saw that cuts to all drug prevention programs across all agencies in the federal government were about 11% cut. So this is something that we are gravely concerned about. Right now, no one in Washington wants to talk about drug prevention at this point. It's a lot about Russia. It's a lot about what's going on in the Senate and with hearings and FBI and all of that kind of fun stuff. But what we do know is that Medicaid over the next 10 years has been proposed. Now, again, this is the president's budget. Just like the governor's budget here in the state, the president's budget will not be fully adopted. There's going to be lots of changes along the way. There's going to be lots of different nuances added. House is going to add what they want. The Senate's going to add what they want. And we need to make sure that we're on top of that, and I think we are at this point. But right now we're seeing he proposed that there be a 47% cut to Medicaid over the next 10 years. What does that mean? That it's mainly a health insurance program for lower income individuals. However, it's been with Medicaid expansion, it is expanded literally quite a bit to include a lot of folks who are using it for behavioral health issues, and we've had an awful lot of folks who are using it for treatment and for mental health issues. So this is something that when you cut this budget in half, you're not just talking about dollars and cents. You're talking about human beings and their ability to get health care, their ability to get drug treatment, mental health treatment, and it really is, we've got to look at it beyond just the fiscal impact, and we've got to look at it from a people perspective. So we're really, really concerned about that. Again, Medicaid is more about the treatment side of things. It's not so much prevention. I don't know of any prevention programs that actually get funded through Medicaid. It's something that I think we've looked at in the past by possibly looking at some peer counseling types of situations that some prevention agencies have done in other states. But right now, Medicaid is not a primary funder by any means of prevention programming. There's also a $400 million cut to SAMHSA that has been proposed. SAMHSA is the federal agency that has the CSAP program, CSAT, the block grants, all of those types of things that fund many of our coalitions and community work that we do, especially around drug prevention. So this is something that we really need to look at, be concerned about. The only pieces that got actual increases were the military funding. They got increases. There's also been additional cuts to the National Institute. How about that one? The National Institutes of Health, the Centers for Disease Control and Prevention, and the Food and Drug Administration. Basically what that is science money, research money. So it isn't something that there's a program within the National Institute of Health about drug prevention, but there are a lot of studies going on. The same with the CDC. CDC, if you haven't been to the CDC website lately, I think it's cdc.gov, you should go there. There's a lot of great information about alcohol use, about opiate use, a lot of their tools and resources. So it's a lot of the science behind that, and that would that would be cut drastically, especially the National Institutes of Health. Their budget really took a hit in the president's proposal. So we really need to pay attention to this. We want to make sure that not only are we doing prevention, but we want to do science-based. We want to do evidence-based prevention. And without some of the science to be funded, we're kind of basically running in the dark. So we'll have more updates on that. But I wanted to give you that. Yes, it's good and bad news. But we really need to focus on some of these cuts that are happening to other agencies. So the state budget. So we have a state budget that is happening right now. It has passed the House. The amendments that have been added, that were added in the House proposal, are still in. The alcoholic ice cream, which means you could have ice cream. You could have shops that sell ice cream with up to 6% alcohol content in their product, is still in there. We're working to try to get that out, but we need your voice to make sure that that is not included in the budget. It really, quite frankly, doesn't have. If you want to look at it from a pure standpoint, I guess, is that this is not a budget issue. This is an issue dealing with public health, and we need debate on it. We need to understand what is the public health benefit? What's the public health risk? What about all those pieces that can't be considered in a budget bill because the budget bill is somewhere around 1,900 pages long? So we need to, if nothing else, I think the proposal would be that, let's have this. There's a bill out there now with alcoholic ice cream. That has had a hearing. Let's debate it on the floor. Let's debate it in committee so that docs can speak up, and prevention and treatment professionals can voice their opinions and concerns, instead of just shoving it in a budget bill where it gets lost among the hundreds of other things that are happening. There are also the amendments that docs that recommend marijuana will not have to give any kind of recommendations as far as what the risks or the benefits are. They could, that basically makes it a lot easier and gives docs some cover. Which, frankly, if you're a doctor, if with any other medication, you're going to go in, okay, this medication might make you have insomnia or have some kind of issues that you you wouldn't think of, that have basically nothing to do with the ailment that you're in for. They do it for every other medication, but because there's so little science around marijuana and whether this is safe at all for people, the docs wanted the benefits and the risks taken out before they recommend any marijuana. I think that's, quite frankly, if we're going to treat it like medicine, let's treat it like medicine. And it's passed already. We're beyond trying to fight, I think, that. But at this point, but I do think if we're going to treat it like any other pharmaceutical grade medication, even though this is not a pharmaceutical grade medication, we need to treat it like docs having a role in telling us what are the benefits, what are the risks. The hub language is still in. There would be a county hub for each county that basically is a person who kind of coordinates all the prevention efforts in the county. We would like it to be someone who is a certified prevention specialist, or whatever they call them now, prevention consultant, I think they're called. We need to make sure that this is also in there. And again, this is $5 million over the biennium, so each county will get some money, I think, based on population and such. So the Senate now has this bill. We have been getting reports over the last 3 weeks that tax revenues have not been coming in as well as they were expected. So just today, actually Monday, there is a budget shortfall that exceeds $1 billion compared to when Governor Kasich, which was in February, introduced the budget. So now they have to fill another $1 billion hole that they didn't foresee. So the Senate President, Larry Obhoff, said that there's going to be between 3% and 4% cuts across the board for many agencies, and larger reductions at some agencies, including the Senate. So this is something that we need to really work, be with our senators on, help them understand the importance of drug prevention. That this is not about, the more that you cut drug prevention, the bigger your down the road costs are going to be. So by funding prevention, by fully funding prevention, you're going to be saving a lot of money down the road with treatment costs, with issues like hospitalizations, drug driving, all of these types of things, which drug driving, frankly, is now more prevalent than drunk driving in this country. So we have to help them understand that. And there is one of the things that they said, that there's going to be a $75 million cut to hospitals in the state. Which is, can be devastating, especially for the smaller kind of community hospitals. This could be devastating to folks, especially those, as we're, we don't have enough, basically the morgue folks don't have enough space for the bodies we've got now. I mean, we need people who are, the hospitals to be around and healthcare to be considered. This is really troubling news. Again, this is just something, I'm literally reading it right now, what the consequences are, and some of their different proposals that they're going to do. So, we really need to be with our senators. We need to work with our senators, contact our senators today, let them know how much drug prevention is needed in our state, and the issues that are happening inside the state right now, especially surrounding the opiate epidemic. I wanted to give you a quick update on the status of marijuana in the country. We have defeated this year legalization initiatives in every state that we've been to, where the legislatures wrapped up. Many legislatures and general assemblies only have a few months that they actually work throughout the year. Ohio is one of the strange states where we actually have a full it's a part-time year-round legislature. Most legislatures wrap up in June and do not come back for the fall. They would come back in January. So we've defeated marijuana in New Mexico, New Hampshire, Maryland, Connecticut. I'll talk about Connecticut shortly. We've defeated recreational legalization in the 3 states at the top there. South Carolina and Tennessee, we've defeated it medically. And then Connecticut is a sort of. So Connecticut, we defeated both of the legalization bills. However, the Democrats added a legalization piece to their budget submission. So they want to help fill, they've got a $1 billion hole as well in their budget, and they want to fund it partially through supposed marijuana taxes, retail taxes that they would get, not considering any of the other down the road costs or any of the ancillary costs, such as, again, the drug driving, the unpaid hospital visits, the employer concerns, all of those types of things. So they're kind of defeated there, but they're trying to reintroduce it, and it will be in a special session later this month. They're going to be talking about that. Rhode Island is still in session. We should be defeating that tomorrow, frankly. Vermont, it was passed through the legislature, but it got vetoed by the governor, and Delaware is still up for grabs as well, although we think we'll defeat that. So what is happening here in Ohio? So right now, the state of Ohio is collecting applications for level 2 cultivators. So these are the smaller growers that would be able to grow. There will be 12 applications that will be chosen in our state, and these are again small growers. They have something like 5,000 square feet they'd be allowed to have, and will be able to grow. And if the demand is there for a necessary growth, they're collecting that through the 16th, which is, I believe, Friday or Saturday, and then they will get notifications of whether they have been chosen or not. Level 1 applications will begin to be accepted by June 19th, or between June 19th and June 30th. These are the large-scale growers. These are 50,000 square foot grow houses, could expand to 75,000 foot. I actually literally just got emailed last night from some poor woman in Colorado who was trying to fight a grow house in her community. The issue with the issue with cultivators, quite frankly, is not so much crime. Not too many people rob these things. There's quite a few different security security means that are happening there. It's more of your property value goes down. I almost said goes to something, but I won't say what I was thinking. What we and the lady in Colorado, one's moving in to the field behind her, so it will be within 20 feet of her back fence, and she's quite concerned about the smell and her property values and such. But they will be accepting these large grow houses. There will be 12 chosen. Between the 19th and 30th, you have an application process where these applications will be accepted. They will also get notified in September so that they can start growing as well. The bills introduced, we have basically beaten both of those at this point, to basically decriminalize or to not allow any federal funding to enforce marijuana laws. Those have both pretty much been defeated, and it's because, again, so many legislators at the federal level are hearing from folks like you on these issues and getting them defeated at the federal level. So good job there as well. So I really wanted to go quickly. I don't know what kind of time I'm having, but okay, so I've got some minutes here. Mary Wolf gave me or sent me a presentation from one of the community, the cultivators that wanted to go into a community. So thank you, Mary. And I wanted to go over it as a whole, because you're seeing an awful. As I read this, it's kind of amazing what they're promising communities, and this is probably good for us to know that on how to basically have talking points against any of these grow sites that are going to be happening in communities. A lot of money involved. However, it is not so much about job creation. These are the 5 things that they talk about in this presentation. The first being job creation. That there are going to be so many jobs that are happening that take place within communities, and that is a kind of a yes and no. It's a high turnover. In other states that we see, it's a very, very high turnover type of job market. It's not something where someone stays long term. There are some people who think they will be getting into the market and into the job creation strategies. But a lot of these folks have some kind of criminal record, so they are not able to work at these different facilities. So it really is not, and quite frankly, as you look around, for a 30,000 square foot grow house that was happening in Colorado, the one I visited, you're talking somewhere around between 17 and 20 people. It's not that great of a job creator. It's not something that we're going to see. I think there said that there's going to be thousands of jobs. In fact, they said that the entire marijuana industry will create 283,000 jobs by the end of 2020. I don't know where they get their estimations at, but it's a New Frontier Data. I get their emails. But very interesting that it is something that we don't foresee. And this is if basically they're taking it that all of the states will be legalized by 2020. Now, with the things that are going on at the federal level, there's a lot of people who are frightened. There's a lot of folks, quite frankly, in California. There's a bill out there to basically kind of rein in a lot of the medical industry and reduce a lot of the recreational industry as well. So, these are jobs, where someone is thinking, that nothing is going to go wrong, that everything, legalization is going to fly through the 50 states. Everyone's going to be legalized. Right now we have 9, basically 8 states in the District of Columbia who have legalization. You'd have to pick up 41 states by the time that 2020 happens. It's absolutely unrealistic for them to think such a thing. As I'm talking to Oklahoma, who doesn't want any decriminalization or anything of marijuana, to have it legalized in less than 3 years is absolutely a fairy tale. So the job creation piece is really, quite the fallacy that's been created. They don't have a whole lot of state numbers. It's, again, this whole job creation across the nation. Again, you're talking 20, probably 20 jobs per grow site, which is not a, what is that? We've almost got that many here at the PAA. There, I referred to it as Prevention Action Alliance. So, not, and we're not basically holding up the city of Worthington either on our tax dollars. So, it's something that we really, need to kind of say this is a little bit hokey. The tax revenue. We keep hearing about, oh my God, we're going to have tax revenues, and this presentation that Mary sent says that we should be, in 2017, the total retail taxes, $745 million across the country. By 2020, they're predicting $2.3 billion in total retail taxes. The problem is, in Ohio, when they're promoting this, there's no tax. There's no sales tax. There's no medical tax. There's no tax at all. You're going to get 0 tax dollars. Don't let them fool you that this is going to be some tax benefit. There is no tax, people. And to be promoting this is absolutely the silliest notion and it's actually, quite frankly, just a bald-faced lie for folks to the medical marijuana dispensary or the medical marijuana cultivators to be telling your city council folks there is no tax. That's what you say to your city and your township folks out there. So absolutely silliness that they're promoting this in any way, shape, or form. And actually, the $2.3 billion, again, we go back to that whole issue of this is as if everybody in the nation decided at one time we were going to recreationally legalize marijuana and have a certain number of a certain amount of tax on it. I mean, it's absolutely ludicrous. Again, this is from New Frontier data. The bill, so Brittany asked the question of why no tax dollars, and it's because the bill does not include any tax dollars. The bill says, just like other medications, you don't get taxed. If you have a $25 prescription for medicine, you pay $25. You don't pay a sales tax. You don't pay any kind of extra tax on it. So in this situation as well, the bill specifically wrote out that there is no tax on medical marijuana. So this whole tax thing is ludicrous. So marijuana is a medicine. I think most people know about this. That we really do need FDA pharmaceutical grade medications where a component is taken out of any kind of compound is taken out of any kind of plant or whatever natural product is out there, and then it is actually put into a controllable dosage. It goes through the science and the testing. Something we have promoted for a number of years, which we're hoping to have Epidiolex literally on the market by the end of this year. We've been told Sativex early next year, and so these are, again, this is going to be something that's you're going to be working with a doctor. These families with these children with severe seizure disorders, you're going to be working with a doctor. You're going to know the dosage. You're going to know what is in the medication. And not just kind of out there doing its own thing. In fact, there was a study by the New England Journal of Medicine, I think it was May 25th, it was 2 weeks ago, that described the difference. They did a study on pharmaceutical grade marijuana products, Marinol basically, and Epidiolex, and the kind of the Charlotte's Web and all of that other stuff that's out there, not pharmaceutical grade, kind of grown in your backyard. Basically what they found is that only 17% of the medications from the backyard growers were actually labeled correctly. So you're talking 83% that were either too high or too low. So it really is kind of silly that that we're talking about that as marijuana's medicine being on the same level as any kind of prescription medication. The black market elimination is, again, a foolish concept to somehow think that we're going to wipe out the black market. Two stats, in Colorado, you still have 40% of the marijuana sold being black market marijuana. The Oregon Police Chiefs Association did in January, they released a report that 70% of their marijuana is sold on a black market. So you're only catching 30% of the entire marijuana market in Oregon. We would be the same way. I mean, you're going to be talking about tons of plants out there. It's going to be harder for police officers to enforce. You're going to have people who are out there with, whatever kind of ailments. You have this 90-day supply, so you're going to have a large amount of marijuana every 90 days. They can do with it what they want, sell it, do, whatever, claim they use it for themselves. So it really is quite foolish. Again, I almost laugh at the claims that they make in this presentation, and wonder what they're smoking. The opioid crisis is also something that really is irking. It irks me quite a bit. They claim that folks who have state medical marijuana programs have less opiate use and less opiate deaths in all of the states that don't. If you look at any of those studies, they don't use all of the medical marijuana states. Some of the states they do use, frankly, do not have operational programs. They kind of cherry pick what states they're going to be using. They also don't take into account any kind of, when they're talking about opiate deaths, they don't take into account naloxone distribution. They don't take into account any kind of programs that are help with prevention of opiate use. When you're talking about Colorado, that actually leads the nation not only in marijuana use but also in cocaine use and methamphetamine use. You're talking about they have also grown their opiate death issue by 95% since legalization. So this is not going to take care of anything. Don't let them fool you, and don't let them show you a study because the study usually says, the studies that we've always seen are that this is not going to make any kind of difference, and we need to look at other kinds of other programs that may have been working in those states. Also, the raw numbers, if you look at them when they're not extrapolated, they actually are higher in those states. But again, for whatever reason, the scientists or the researchers in these studies are taking these from different sources and not fully accounting for some of these programs that are not operational. I mean, Maryland, for instance, not a workable program at all yet, and so we have plenty of opportunities to combat these types of things and give talking points, and we just need to make sure that we understand what they're trying to say and that we do have ammunition to combat any of these things. So also, big news, Dennis Rodman going to North Korea. Why am I mentioning that? Because who's funding him? A cannabis grower. North Korea basically is one of the larger marijuana markets in the world, and a cannabis grower is actually fund. So as you look at the big North Korea Dennis Rodman thing, you wonder what kind of a business they're going to be undertaking in that very secluded country. So that was my tidbit for the day. If you listened to me all this time, you got that to share with your folks at lunchtime.
Thank you so much, Tony, and thank you all for the questions that are rolling in right now. Again, my name is Brittany Sandage here at Prevention Action Alliance. We will stay live and answer your questions as long as you want to pose them. Tony, our first question was specific to the Ohio's work around the marijuana, and the question was how many level 1 grow sites will be accepted and how many level 2s?
There will be 12 level 1s and 12 level 2s that will be accepted. And again, level 2s will be smaller grows, not nearly as expansive. The level 1s will be warehouse types of structures. A lot of when I visited the 35,000 square foot grow house in Colorado, she was spending about $30,000 a month in just electricity. So, as you talk to your folks, as you talk to your city council folks who are considering these types of things, they also need to consider the types of water, the amounts of water. Linda Miller from Geauga County reminded me that there are some communities out there that use well water. So it's not city water that is it's actual well water, and that could really tap into a local community's water supply, especially when you're thinking about marijuana plants. Some could use a gallon of water a day per plant. So that's if you have a 50,000 square foot grow facility, that's a lot of water and a lot of electricity that we need to concern ourselves with.
Thanks, Tony. We've got one more question around the marijuana and then another more about some of the work around the hubs. So I'll start with the marijuana. We had a question from Nicole. In terms of what you just revealed around these cultivator promises and some of the snapshot, would it be possible for us to summarize that for them? I think that's doable, but I just wanted to pose that to you, and what kind of form might we be most useful for folks?
Yeah, absolutely we can. In fact, we can come up with a one-pager about that basically is kind of what we have here on the screen, and then talking points under those to basically how we can talk about each of these issues and combat them. Because again, these are the majority of them are quite silly in just their premise. So they're not hard to fight. So it basically is us just putting them down on a one-pager, sending them out, and letting folks use them as they may.
Thanks, Tony. And I think it's such a timely conversation to have this at this point. So many people will be using the summer to revisit their media advocacy work at the local level, and this is a wonderful time to have that information. We had another question going back to the community hubs that are currently in the budget language. In terms of for clarification purposes, when we're looking for where we are right now, getting to the table, is that something we need to be doing right now locally, making sure that our voices are heard, that we're identified as one of these potential partners in the fight, or is this something that we could have a larger state unified voice on, or both?
It really is both. First off, the senators need to hear from us that yes, this hub, again, it's $5 million that can be pumped into the local community. The importance of this hub concept is that this is not something that is going to state entities. This is not something that will go to Prevention Action Alliance, or this is going straight into the community, which is something we really, really advocated for and really, really pushed. We didn't, we don't want, cuts of any of these types of budget issues. We want money to go to the local communities where you got boots on the ground doing the work. A lot of times not the resources. The other thing you really need to do is advocate with your county commissioner. There are usually 3 of them. I think Summit County is the only one that doesn't have a county commissioner system set up. But go to your county commissioners, because they're the ones who are going to get the money. When we talked to the County Commissioners Association, they were a little bit concerned. They didn't know what to do with it. And were they just going to give it to someone that really didn't know what they were doing? So getting in touch with your county commissioner, this is a great way not only to advocate for prevention, but also, teach these county commissioners a little bit about prevention and what's going on in the state.
Tony, we've got a comment from Andrea. Apparently at a lot of the local communities, this is not the first I've heard of it, there are folks coming in and promising astronomical benefits, $150,000 for the first year in tax revenue, $700,000 from property taxes on businesses. What do we know sort of about any kind of concentrated efforts that are out there? What can folks be doing to combat these arguments that are coming in, especially into the rural communities?
I mean, there could be some property tax and some basically income tax, but you're talking about someone who works at when I asked a lady out in Colorado, and I'm going out there next week to visit this woman again. She's very nice. She just happens to run a marijuana grow house. But she said that the average pay is $30,000 a year for her employees. So if the average is 30, some people are getting paid probably 26, some are 34. Obviously, she's making a lot more because she owns the place. So it's not a great deal of even income tax that is coming in via these different grow houses. Again, you may get some property taxes, but as sure as any other business, you're going to see them advocating for business tax write-offs and things like that that every other business gets. So, and the whole sales tax or marijuana tax, there is no such thing. I mean, I can't. It again is irritating that they claim this. No specific communities. In fact, all of the fees that are going to be received from the from these grow houses, they have to pay, if they get a license, they have to pay $200,000. The level ones. That doesn't go to local communities. That goes into the state coffers. That goes into the state system to actually implement this. Program, and then to enforce it from the state level, not the local level. This is not going to come back to communities. None of these fees are. We had tremendous conversations about this at the I'm sorry, not the last one, the former Medical Marijuana Advisory Committee, and it was kind of shocking that this was all going to the state, and there were some news articles about it. So this is not coming back to communities. Again, you'll get a little bit of money with income taxes from the folks who actually work at these places, and some property taxes, but you're not talking any kinds of amounts that's going to really even probably pay for one police officer in your community. So I would really question and ask them to really think about what kind of taxes are we getting here, especially when the bill itself says we aren't allowed to collect taxes on medicine.
Tony, thank you so much. Thank you to everyone who logged in today and for your participation. One of the great values of these webinars are the live Q&A, being able to respond to the issues that are facing all of you, as well as ways for us to make sure that the information we're collecting, we're digging as deeply as we can. Just a quick housekeeping note, we are going to sign off for the day, but we will have this video up and live on YouTube no later than tomorrow morning. You'll receive a link in your follow-up email in a few hours that also contains your certificate for participation. If you are interested in continuing the conversation or have additional questions for Tony, he can be reached at tcoder, T-C-O-D-E-R, at preventionactionalliance.org. And certainly you can call our offices at any time and we'll put you in contact with each other. But again, thank you all so much for your participation. Thank you for the great work you're doing at the local level. And we look forward to speaking with you next month. Have a great day, everyone.